Hello everyone! First of all, let me introduce myself. My name is Wanda Aprilia Putri from Central Borneo. I'm a new student of the Health Polytechnic of the Ministry of Health Yogyakarta, majoring in Medical Laboratory Technology. In this video, I will explain to you guys some things about HIV or AIDS on a poster I have made, which is titled Protect the Body from HIV or AIDS. So what is HIV or AIDS? HIV, human immunodeficiency virus, is a virus that damages the immune system by infecting and destroying CD4 cells. If more and more CD4 cells are destroyed, the body's immune system will weaken so that it is vulnerable to various diseases. HIV is a lifelong disease, which means it will stay in the patient's body for the rest of his life. HIV that is not treated immediately will develop into a serious condition called AIDS, or acquired immunodeficiency syndrome. Based on this type of HIV or AIDS disease, prevention should be prioritized because the treatment is not easy and very difficult to recover. Based on data from the Indonesian Ministry of Health in 2019, there were more than 50,000 cases of HIV infection in Indonesia. Then, how HIV spreads? First, by having sex. You may become infected if you have vaginal, anal, or oral sex with an infected partner whose blood, semen, or vaginal secretions enter your body. The virus can enter your body through mouth, sores, or small tears that sometimes develop in the rectum or vagina during sexual activity. Next, by sharing needles. Sharing contaminated injection drug, paraphernalia, or needles and syringes puts you at high risk of HIV and other infectious diseases such as hepatitis. Next, from blood transfusions. In some cases, the virus may be transmitted through blood transfusions. Hospitals and blood banks screen the blood supply for HIV, so this risk is very small in Indonesia and other upper middle income countries. The risk might be higher in low-income countries that are not able to screen all donated blood. Next, during pregnancy or delivery or through breastfeeding. In fact, mothers can pass the virus on to their babies. Mothers who are HIV positive and get treatment for the infection during pregnancy can significantly lower the risk to their babies. Meanwhile, the number of AIDS sufferers in Indonesia tends to increase. In 2019, there were more than 7,000 AIDS sufferers with more than 600 deaths. The significant increase in cases indicates a lack of attention from the Indonesian people about the dangers and prevention of HIV or AIDS. People with HIV experience a mild cold 2 up to 6 weeks after becoming infected with HIV. The flu can be accompanied by other symptoms and can last for 1 up to 2 weeks after the flu improves. Other symptoms may not be visible for years, even though the HIV virus continues to damage the subject's immune system until HIV progresses to an advanced state of AIDS. Possible signs and symptoms include fever, headache, muscle ache and joint pain, rash, sore throat and painful mood sores, swollen limbs, glands mainly on the neck, diarrhea, white loss, cough, and night sweats. In most cases, a person only finds out that he has HIV after seeing a doctor due to a serious illness caused by weakened immune system. Serious illness include chronic diarrhea, pneumonia, or toxoplasmosis. Perform work that involves contact with human body fluids without using adequate personal protective equipment. A deadly disease similar to HIV has very mild symptoms at the beginning of transmission. We cannot detect or guess whether infected with HIV or not. We also don't know people around us who have HIV disease in their bodies. Because what? Because the symptoms are very minimal. Progression to AIDS. Access to better antiviral treatments has dramatically decreased deaths from AIDS worldwide, even in research poor countries. When AIDS occurs, your immune system has been severely damaged. You'll be more likely to develop disease that would not usually cause illness in a person with a healthy immune system. These are called opportunistic infections or opportunistic cancers. HIV transmission can be prevented by the concept of ABCDE, namely A or abstinence, which means for those who are not married, not having sex outside of marriage is the most appropriate step to avoid exposure to HIV. B. Be faithful, which means be mutually loyal to one's sex partner. Avoid the behavior of changing partners to minimize the possibility of HIV transmission. C. Condom, which means use a new condom every time you have sex, either vaginally or rectally. When choosing a lubricant condom, be sure to choose a water-based lubricant. Avoid condoms with oil-based lubricants because they can make the condom leak. D. Drug no, which means avoiding drug use, especially drug injection needles, can prevent a person from becoming infected with HIV. In addition, avoiding sharing needles can also prevent hepatitis B virus infection. And then E, education, which means providing correct information about HIV, modes of transmissions, prevention, and treatment can help prevent HIV transmission in the community. HIV or AIDS disease will definitely continue to increase every year if people still have little knowledge and concern for themselves about how to prevent HIV or AIDS disease. Prevention of ABCDE is the separate heart of community outreach in the hope of reducing the number of HIV or AIDS cases in Indonesia. ABCDE prevention is very short and easy for people to remember so that it can be continuously applied in everyday life. ABCDE prevention socialization is expected to be a way to realize Indonesia without HIV or AIDS. Let's apply ABCDE prevention in everyday life. Easy to transmit and difficult to cure. That is my explanation of HIV or AIDS. I apologize if there was any wrong when I explained it. Thank you for your attention guys and see you.